Welcome to IRG's Health Talk. I'm Tom Hutler along with Shannon O'Kelly, physical therapist and president of IRG Physical and Hand Therapy. And our guest, Trevor Petrie, hand therapist from IRG Edmonds Hand Therapy.
Trevor, welcome. Good to see you. Hey, recently we had Dr. Heidi Shores on, orthopedic surgeon from the Virginia Mason, and she specializes in hands and hand surgery. And we talked to her about distal radial fractures of the wrist. And you being a hand therapist, we're going to talk about the rehab portion of that or the post-op care and treatment. But before we talk about that, tell us what your background is and what your specialty is so our listeners know that you have this expertise in this area.
I have my master's in occupational therapy from the University of Washington, and I've been a practicing hand therapist now for 3 years. I did my internship at Harborview in their outpatient hand therapy clinic, and then I've been working for you guys pretty much since then.
And so your area of interest is the treatment of hand injuries, repetitive trauma injuries of the hand, but basically rehabbing the upper extremity.
Hands, elbows, I even get a little bit into the shoulders, but yeah, pretty much the entire upper extremity there.
Perfect. And you're located up at our Edmonds Hand Therapy clinic, and you probably in your practice see a lot of distal radial fractures. Tell us what your focus is when you're rehabbing that injury.
Well, the first thing I have to know when I'm treating a distal radial fracture is whether or not it's been fixated by the surgeon, meaning if they've put a plate or some pins in there, or if it's just been what's called a closed reduction, where they just kind of pull it back into place and then put a cast on it. If it's fixed, it's going to be a little bit more stable, so we get to do a little bit more in the way of motion a little bit earlier on. I don't have to worry so much about displacing the fracture. The downside is there's going to be more scar tissue, so I have to be more aware of that and making sure I'm treating that as well.
And with the fracture, and a lot of times with the repair, the resultant is kind of limited mobility. So as a therapist, your goal is really to kind of get the mobility back into that joint and really focus on function so these people post-operatively can get back to what they like to do.
Right. As a hand therapist, my goal, my focus is first, second, and last is to get someone functional again. Usually that means to get their range of motion back, their strength back, and all that kind of thing too. But every once in a while I have to tailor activities to the patient. If they've got some special job they need to get back to, they might not get the range of motion they had before. They might only get about 80-90% of that. And if they're, say, a mechanic, something like that, we have to figure out how to problem solve, troubleshoot, so they can get back to work doing what they need to do. But yeah, range of motion is a big one. Strength is a big one. Swelling tends to be a really big problem with distal radius fractures a lot of the time. Patients oftentimes are a little disheartened by the amount of swelling that goes on and how long that goes on in the wrist. And I have to remind them that the amount of force it takes to break a bone does a lot of trauma to all the soft tissue around that. And that doesn't necessarily show up on an x-ray. So I have to keep reminding them to be patient, to be consistent with their home exercise program. And I have to establish trust, because oftentimes that can be kind of a scary thing for a patient to lose the function of their wrist and their hand. And so I just have to keep telling them, if they just listen to me and if we work together, then when slow and steady, we'll get them back to where they need to be.
Yeah, and you mentioned slow and steady, which I think is important, because I think a lot of people kind of have this impression that going to therapy, whether it's physical therapy or hand therapy, it's going to hurt. And really, that's not our goal as therapists. Is really our goal is to build confidence and progress people in their comfort level and ultimately return them to pain-free functional activities.
Absolutely. Slow and steady. I always tell my patients you should feel like you can do your home exercises every hour on the hour without any increased pain over the course of the day. One of the terms I like to use is you can be a little uncomfortable, you should have some discomfort, but unless I specifically say this might hurt, you don't want to cross over that threshold into pain, because oftentimes you'll kick up an inflammatory response, and then you build up more tissue. That new tissue then tightens, and then you can actually take a step backwards as far as range of motion goes once everything kind of settles down. 2 or 3 hours later, you go to move your wrist again, you find that all that motion you may have gotten from cranking on your wrist is not only gone, but it's actually regressed a little bit.
Right. And our ultimate goal as therapists is really to allow these people to be independent. I mean, our goal is not to see these patients. We love seeing these patients, but our goal is to get these folks independent so they can do this at home and return to normal activities as soon as possible.
Absolutely. People always ask me, how long is this going to take? And my stock answer is that to get back to 100% of what you are going to have, not necessarily what you had before, but what you're going to get, sometimes can take upwards of a year and a half. And as much as I might like my patients, I'm generally not going to let them keep coming to me for a year and a half. I'll see them usually 6 to maybe even 12 weeks, depending on the extent of the injury. I want to discharge them. I want to get them functional. I want them to be comfortable out on their own, doing the things they need to do to get back to where they need to be.
Well, good stuff, Trevor. And if a patient or one of our listeners wanted to get a hold of you and have a conversation, how would they reach you?
You can always go on to the irgpt.com website and look us up at Edmonds Hand Therapy. We are located in Edmonds on 220th, right across from the Edmonds Woodway High School.
Thanks, Trevor.
If you'd like more information on this topic, as well as how to contact Trevor Petrie, go to irgpt.com and click on the For Health tab, or go to IRG Physical and Hand Therapy's Facebook page.